Thank you so much for having me and that warm welcome. I'm really looking forward to speaking with all of you today. I know coaching is something that is really a part of the fabric here there at Stanford, and I hope that this helps weave a little bit into that fabric. And also, I'm looking forward to learning from you as we go into the Q&A portion of the talk. So to start us off, there we go. Excellent. So what we're going to do today is to start off and just consider this concept of well-being, which I know is very much integrated into the work that happens through Stanford. But making sure we all have a sense of what really does well-being mean for us in the workplace, and what does it mean for us as individuals as well as for organizations. How does coaching actually play a role in supporting well-being of our learners, of our colleagues, and of ourselves in the workplace and outside of the workplace? And how exactly coaching works to be able to support that. And knowing that people have different abilities to engage in coaching offerings and opportunities, I want to make sure that everybody walks away with something that they can use today to be able to support learners, to support colleagues, and to support themselves in using these tools beyond this talk. So we'll dive in first to just make kind of frame things where if I had come to give this talk several years ago, it would have been about physician burnout and this physician crisis. And as many people are well aware that this is no longer just an attention paid to physicians, and that it's really healthcare workers across the spectrum obviously feeling burnout. That's been the case all along. The difference now is that people are really focusing on it in and outside of our workplace environments. And it's gone from being well, if only you could handle your stress better, or if only you were more resilient, to recognizing, and I love the way this image sort of just highlights how all of these factors rest on our shoulders as we think about the work that we are all trying to do, whether that's direct patient facing work or work that's on the periphery of patient care or connected to patient care. We are facing so many different challenges that impact our experience of the workplace, and then for many can lead to burnout. And so what's important about this slide is not just like to highlight the issue and what really brings us all to the forefront, but to really think about all the different ways that these concepts are important for us to address as we consider different interventions to support people and create a better workplace culture. And I think what's important is that if we look back, I mentioned, oh, if I was here 5 years ago, well, if I looked back in the literature 20 years ago, 30 years ago, there were perspectives about burnout long before managed care, long before Epic or any of these EHR systems that we love to blame things on, long before COVID. So if burnout has always been part of the system, is it right to address all of our energy on eliminating burnout? Or perhaps do we shift our focus instead to thinking about how can we cultivate well-being in our workplace environments, in our teams, and in ourselves so that we can be a positive part of our workplace environments and help to contribute to that for others? And so as we do that, we think then about the different dimensions of well-being and what supports well-being for individuals and for organizations. And that takes a little bit of work because if we were to look up burnout, you would see a very crisp definition. It's a syndrome characterized, la, la, la. And every article you read about burnout, we'll talk about that. Well being, though, it takes a little while. You got to kind of back into the definition. So we could think about just general well being, which the WHO would describe as a state of being comfortable, happy, or healthy. And I can relate to that as like a person in my home and what does and doesn't support that. But when I think about being comfortable, happy, or healthy, I don't necessarily think of work. So, how do I then take that word well being and think about it as a professional? Well, this then I think is where we can start to wrap our minds around how we can start to contribute to and start to understand this concept as it relates to us in the workplace and as healthcare workers. So professional well-being, we think then about the experience of positive perceptions, feeling good, having good feelings about who you work for, who you work with, and what you are asked to do, and the presence of conditions at work and beyond your work that enable you to thrive and achieve your full potential. Like that sounds like almost like a mission statement, like it's calling me to action. And if you have professional well-being, you likely have very high work life and job satisfaction and a positive relationship with your workplace and a high quality working life. And that when you're at work, you have meaning, you have purpose, you're engaged and feeling that fulfillment. So as we revisit this conundrum of is it about burnout or is it about well-being, it's important to note that burnout is an obstacle to well-being, but not being burned out does not then assume that you have achieved well-being. So I would argue that let's focus our energy on this concept of well-being and understanding that burnout is a part of this dynamic, but that we want to think almost as a way to really push ourselves for that call to action of what it would look like to create these perceptions and presence of conditions at work and beyond. So in order to do that, we have to visit another controversy. Is it wellness or is it well-being? And what this slide does for me is lay it all out in a way where it's not actually an argument or a controversy, it's all part of a story. Each of us have a role in supporting our wellness. Our workplace may take away from that, or what we are asked to do, or our relationship with our workplace may impact our wellness. But we have some individual control, autonomy, agency in supporting our own wellness. And there are things we can do to do it better. There are things we can do that will take away from it. But when you cross over this second level here into the third, into well being, that's when it's not about us anymore. Yes, we play a role in engaging with these variables, but when we think about these terms and when you look at the definite, like what's below it, belonging, esteem, and self actualization, this is something that our workplace environment helps us to connect with. This is well being, which is more than just an individual's role, but it's an organizational responsibility to create the workplace conditions and the workplace environments that help us meet our social needs, have positive team dynamics, be a part of a positive workplace culture where we can connect with others and fight loneliness and isolation, where we feel like we trust those who we work for and work with and are respected in return. We have the autonomy to engage with our work the way we want to and transparency within the system to understand the different dynamics at play. And as we do all of this, we are able to be that best version of ourselves, where we are living our life with our purpose and connected to our values and really feeling empowered by that. So, where I see that dashed line is where I see the responsibility shift from the individual to the organization. What's important, though, is that coaching can help us certainly connect with the lower levels and what we can do to support our own wellness and can really help give a voice to what's important drivers and variables for the upper levels. So, we'll walk through that. Tate Shanafelt, who I know you all must know very well there, and it has been a great mentor to me, has done a wonderful job of really painting the spectrum of how this discussion has evolved over time and how to really reach this level of well-being 2.0, we need to shift our mindsets as individuals and shift our mindsets as organizations. So first, thinking about us as individuals, really changing how we think about the concepts such like work-life balance. I would love it if after this talk, none of you ever use that term anymore. Because I have terrible, terrible news for you. There is no such thing. And in fact, it's actually work-life integration that we're seeking. And the Surgeon General recently talked about it as work-life harmony. This idea that all the different parts of you need you, all the different parts of your work and your life are important and you can assign a priority and an importance to it. And they're going to call you at different ways at different times. And rather than trying to make it perfectly balanced one side or the other, it's really understanding how the factors at play affect each other and your connection with that and how you feel about that, which involves a hefty dose of self-compassion and a lot of growth mindset and recognizing that we are humans and we are vulnerable, that we are not heroes, and really shifting to thinking about rather than just keep forging ahead and keep being stronger, really connecting with these concepts of leaning on our communities, being active contributors and parts of communities, and connecting to a life with meaning and purpose. And so as we consider ourselves as educators, so we are individuals, but we are also responsible for our individuals. And it's important for us to remember these last two images, the pyramid as well as that shifting mindset, where we set the tone for our team and our learners. I hear so much about how learners will look at an attending and be like, I'm not sure I want that life for myself. And that recognizing how we approach life and our style of how we engage with this and how we choose to use our voice and how we choose to frame our perspectives sends a message to our learners of what we value and believe is important. Now, I want to make sure I'm authentic here. I'm not asking you to fake it. I'm not asking you to not be frustrated when things are frustrating. I can imagine in a system like yours, there are frustrations just like there are in a system like mine. And not everybody's happy about it all the time, but really thinking about how are we role modeling how we use our voice? How are we role modeling the choices that we make and how we lean into challenge and engage with it? But it's also important to recognize that we tend to put our well-being and our wellness last in service of supporting everybody else. It's important to role model that actually by caring for yourself, by meeting your needs, and by supporting your well-being and advocating for that, you are actually being a role model for others to do that for themselves. But again, it's not just about us. Our organizations have a real responsibility to support our well-being by taking action and by really helping to understand that we are not part of patient-centered organizations. We are people-centered organizations. Patients are critical, obviously, as a part of this, but there are people who are critical who take care of those patients. So we are all humans as a part of a system, and the more our organizations can think about being human-centered as opposed to patient-centered, the more we will lead with decisions that really show our value and show our belief in individuals and really develop that trust within the system. But also as there's more systemization throughout mergers and systems being built and being grown, we tend to have standards and and ways that all people must have this type of template or that type of approach, and really helping people understand where is the customization within the standardization. How can we encourage flexibility within this system and really think about it as a part of that? And helping to really cultivate fulfillment for individuals within a system, understanding the value of that and how that contributes to the greater system. The Surgeon General did an excellent job with this image that recently came out, where he really brought this to the forefront and talked about how can we amplify the worker voice and create this sense of equity. I think many people will feel that this like purple circle on the top is probably better than it was before, but not an assumption for everybody. But as we consider, we want to protect people from harm. And people can really connect with that pretty quickly for the most part. But these lower circles are definitely areas of opportunity for growth for our organizations. Really thinking about how are we creating opportunities for growth for individuals to really thrive and learn and develop within themselves and have accomplishments that they value. How do we build connection and community, create a sense of belonging, inspire and encourage work-life harmony? And that concept of flexibility really comes into that. And how do we help people see and feel that they matter as a part of their workplace? And so these are all ways that we as organizations can support our individuals in moving towards this concept toward well-being and to feel that and live that within their days. Now, this is a very busy slide, but a lot of organizations will say, I don't even know where to start. Like, how do we even think about this? Well, oftentimes I say to people, well, let's just think about what, you hear about pebbles in the shoe, or you hear about the things that really are driving burnout or frustrations. If you simply looked at administrative burden and thought, how could we decrease that? Let's think about all the different ways we could focus. And there are different ways that you can look at that. You can look at how people perceive their effort, the mental effort that's required of them, the physical or the temporal demands on them. There are so many ways for organizations to act, but sometimes it takes the individuals within them to be able to articulate the challenge, to be able to magnify that, to be able to quantify that, and to be able to use their voice in the most effective ways. And this is really the setup for me to start to explain to you where the role of coaching can come in to contribute to organizational well-being as opposed to just one-on-one. And so much, all of this really boils down to this concept of value and appreciation. The more an organization can acknowledge the inherent value of an employee, the more they can focus on that person as being someone of worth and a human being the more you can build trust and connectivity, and that is what keeps people coming back. That is what stops people from leaving. That is what makes people want to leave that organization when they eventually do better than they found it, and to be a part of progress and to be a part of change as opposed to resist it or say, why bother? And so much of it, sort of looking back at this slide again, is rather than adding nice things for people to do in the free time they don't have, what can we take off of their plate? What are the things that we can do to say, I see you, and I'm going to do this thing that's going to alleviate this burden from you? And again, the part of our individual responsibility there is to be able to name it and to be able to articulate the challenge. And that, again, is where coaching can play a huge role. And so there are so many different applications that you'll hear about for coaching in healthcare. And I think it's important to stop and recognize that the word coaching is used in many different ways. Probably similar to my organization within yours, maybe all of these things are happening. So you could have coaching in the moment where you're supporting somebody during a time where they're processing an experience. You could have coaching over time where you're really doing developmental coaching, helping people set a vision for themselves and meaningful goals over time. There's performance coaching, where you as a coach are an expert and are really doing feedback and skills development. This is very similar, like the whistle and clipboard type of coaching. And then there's coaching for remediation, which is a very nuanced field of coaching, where the skill required here for it to truly be coaching is high, but that the coach helps that person undergoing remediation process feedback, create a new narrative where they can use that feedback to build for them and not take away from them. Develop a constructive success plan with accountability built in, and then set goals and work toward those goals and revise goals over time. So the type of coaching that I'm going to share with you about, which the bulk of my research has been on, is in this area of developmental coaching. So this type of coaching, actually, if you envision this stage coach, that's what I try to teach our coaches to be. You, as the coach, are the vehicle. You are the vehicle for a journey to help someone of value, meaning that you believe in them. You believe that the answers are actually already inside them. The experience that they need, they already have. And you, as the coach, as the vehicle, are creating the space. You're not the driver, you're not the navigator, but you are the vehicle for that person to go on a journey, bringing with them all the skills and information that they have and bringing that into the vehicle and going from a place where they are to a place where they want to be. And that's really defined by them. And so this space, when you use these coaching skills, is a really thought-provoking and creative space where people don't come in to get their problems fixed or themselves fixed, rather really coming in to maximize their potential and be the best version of themselves and think about how to bring that to all of their experiences. And that in this vehicle, the personal, the professional, all the different parts of them can come in. And as the coach, your job is not to fix them again. Your job is to not give advice. Your job is to not give reassurance, but rather create the space where they can find their own way. They can provide their own reassurance and start to build their own belief in themselves that they are capable of moving toward their goals and have all that they need to do that. And really, the vehicle, the coach, creates the space to get that out and to process that and to constructively set a plan to move forward. And so how does this work in terms of supporting learners in particular? Well, I have another terrible thing to share with you, which is that stressors are inevitable. We cannot reduce the stressors that our learners are going to feel in our learning environments completely. So if we know that stressors are inevitable, and in fact, there probably is some value in the learning that one experiences when they go through stressors. If we believe that, then what coaching can really do is help reduce the struggle one feels when going through a stressor. So imagine currently you have your trainee or your learner who's going through a stressor, and they inevitably get through that stressor and they move on, and maybe they learn some things, maybe they don't. Some may struggle and suffer. But perhaps instead, what if we were to help them through coaching create an environment where they could process their thoughts about that stressor, consider the experience, reflect on the experience, and identify truly what is the challenge and what are their feelings about that challenge? And then use walking through these, really considering, like, what about this is most important to you? What about this stressor would be most helpful for us to focus on? How do we want to use our energy in ways that will serve us, as opposed to perhaps using our energy in ways that detract from the overall growth and outcome of the stressor? What is working for us? So much of coaching is about positive thinking. This is hard for medical educators because we often are like weaknesses. We have to eliminate weaknesses, but instead consider, how can we help this person build by understanding who they are at their best, understanding what's already working for them, and use that to really use to be a platform for their growth and development. And then motivation. Rather than considering what other people want for this challenge, what is intrinsically motivating you to get through the stressor and to grow? For confidence, how can we understand how you've faced challenges before? Who are you at your best? And how you can use that to apply to this, to come at it in a new or different way. So that when you do and you come up with this, rather than me coming up with it for you and giving you advice, you build the confidence that not only did you face this stressor, but you can do others, you face others using this paradigm and using this approach. And also considering, what are the social supports within your environment that you can lean on so no one is going at it alone. And so this process right here is the coaching process. And hopefully when one goes through it, not only do they get through to the other side, but they thrive and they grow and the stressor contributes to them as opposed to taking away from them. So to look at each of these bubbles, we talked a bit about the positive psychology, really reversing the focus from the negatives to the positives. It doesn't mean that we don't consider what's not working. It doesn't mean that weaknesses don't have a role in the conversation. But it's really considering what is making us feel good, what is right about our environments, what's right about us, and how can we use that to grow and to develop. And so really helping people see and unpack the positive of what's working for them. And additionally, this positive psychology helps us think differently, think more creatively, and to come at challenges in new and different ways. And we discuss motivation, so how to really connect people to what's intrinsically motivating them to face this challenge in a different way, what's motivating them to rise in the face of the stressor and come out a better person on the other side. And really considering what about this drives them to succeed. Building their confidence through their strengths and this concept of self-efficacy, which is really the truest outcome of coaching. The idea of self-efficacy is the belief that you can do something because you've done it before. And so if we think about, someone facing a tough call night or a feedback conversation about something that didn't go well, let's think about who you are at your best, when you've had your best conversation, when you've been the most organized on call, and how can we use that to consider how you might do it differently next time? What strengths have gotten you this far, and how can we tap into that to build up who you are and what you're capable of? And then this concept of social support theory, I think is very interesting because many learners go at things alone, either because they're not aware of the supports, either because they feel like they have to do it and that's like a way to grow, or perhaps there's some sense of shame or concern about how people will be viewed if they do lean on supports. But this is where organizations can really step up to say, we know that there are going to be stressful events. This is something that absolutely will happen. And so what are the different coping resources we can help people develop as an individual and the resources that we can provide as an organization, and then help people connect with those resources so that they have better outcomes on the other side. And so simple questions like, who are the people who can be in this with you? What are the supports that you can lean on? Are important coaching questions that can help people rise in response to a stressor or a challenge. And then the focusing on what's most important is perhaps one of the most valuable things a learner can really start to understand for themselves. How can I use my energy in ways that serve me, either by using my energy to proactively fill my tank or stop connecting with something that proactively drains my tank? How can I change the way I engage with my environment and use the agency I do have, even when I feel like I don't have much, to actually contribute to my resilience as opposed to take away from it? Note that I am not saying make you more resilient. Nothing about coaching is making people more resilient. We, as healthcare workers, are resilient people. And so the idea is, rather than making us more resilient, How can we help people connect with their resilience, connect with that best version of themselves, and bring that to their challenge? And so the way that this all works is actually relatively simple, although I'm now boiling the coaching science down to one slide. So I want to acknowledge that for any coaching experts in the room. But in my experience, the way to transform any conversation with a learner, a colleague, or yourself from a regular conversation, a mentoring conversation, to a coaching conversation is with these three skills: how you listen. And by that, I mean listening to really hear the other person, really understand what's on the other side, and listen as if you do not already know the answer. I'm a primary care physician. I come in the room most of the time assuming I have answers the other person needs. They have problems I need to figure out. That makes me a great doctor, but it doesn't make me a great listener in a way that people sometimes need you to listen to them. When I'm mentoring someone who wants to do what I do, I definitely have answers that will help them. And they're good answers. And I have advice, but that doesn't make me a great coach. It does make me a helpful mentor to them. So the way I transform myself from doctor, mentor into coach is by letting go of the assumption that I have answers and they have problems I need to solve. So I'm not listening to fix anything or know anything. I am only listening to understand that person and their journey. In the coaching world, they call this listening with a beginner's mind. But in my experience, if this is not how a coaching conversation starts, it rarely ends as a coaching conversation because we default to mentoring and advising and advice giving. And so listening with that beginner's mind as if we don't already know the answers and that we don't need the conversation to go anywhere. This is about them. It's not about us. As you listen with that beginner's mind and really listen to understand, you hear things that come out of their mouth that they themselves have maybe never said out loud before, or maybe never said out loud like that. The way that you reflect those things back helps them to see what they are saying, see what's behind their words, and invites them to explore that further. And so, simply put, reflections are how you show that you are listening by stating back what you just heard. Not in a way, though, to summarize, in a way to invite them to keep going. So, I don't need to do a soliloquy saying, so everything you just said is X, Y, and Z. I might just pick one thing and say, wow, it sounds like it was really hard that you had this great idea and nobody was listening to it, even though you knew it was right. And then you pause and you listen some more and you let them unpack that and you let them talk about that and then you reflect some more. The bulk of a coaching conversation is the coachee talking and the coach listening and reflecting. If we think back to that definition of coaching I shared with you earlier, how to help someone go from where they are to where they want to be, listening and reflections helps them identify where they are and where they want to be. The way that a coach helps them move forward towards where they want to be is the questions. So as a coach, your powerful questions, once you really understand the points on that journey, help them really think about, all right, so if that's who I want to be, if that's what I want this to look like, where do I get started? How might I ask for help? What might I try? How will I get that started? And so your how and your what questions as a coach really help to unpack that journey forward and keep that a coaching conversation as opposed to a mentoring conversation or advising conversation. And so these three skills together, listening and reflecting, combined with asking powerful questions once that journey is sort of identified, is how you can transform your conversations today into a different conversation. And this is what I teach our coaches at MGH and at other places where we use this model around the country. So back in 2012, we developed this trainee coaching model at MGH, which has now been spread to dozens of residency and fellowship programs around the country, as well as different professional societies and other organizations. And in this model, coaches are faculty members, and we now have expanded that to not just be physicians, but also other role groups. And they volunteer their time. They undergo 3 hours of training a year, and that training also includes a curriculum, a guide for the conversations, like a manual for the conversations, as well as practice exercises and training videos that they can watch after the session so that they can refresh their skills. They're paired one-on-one with a trainee, either a resident or a fellow, and that pairing is mismatched so that the coach and the trainee are not in the same intended field. So as a primary care physician, I only get coachees in non-internal medicine fields or people who are bound for specialty within internal medicine. That does two things for that coaching relationship. One, it creates a safe space for that trainee so that they can talk about whatever they want. They botched that surgery, their attending had to bail them out, they had a terrible call night, they suddenly realize they don't want to go into oncology anymore. They can say anything they want. They're going through a bad breakup, whatever it may be. And I have no skin in that game. They're never going to see me at a job interview. I'm not writing them a letter. It's their space. But also it protects them from me mentoring them because I don't have the first clue what an OBGYN resident should be doing with their time and how they should be engaging in things. So I don't even try. And I can just be their coach without worrying about what I need to do for them other than create that space. They meet quarterly with their coach, and as I mentioned, there's guides and a curriculum that walk them through, which is all based on those 3 skills that I already shared with you, as well as the structure I'll share with you in a moment. And these conversations are considered confidential. And what that means is that it is a workplace program. So if somebody is worried about the safety of the coachee or a safety of a patient or somebody else within the organization, we do have to share those concerns. And our coaches, as part of the training, do get education in how to do that and where to do that and what to do if they're not sure what to do. So here are the 5 steps for any coaching meeting, regardless of what year of the curriculum they're in or who they are coaching. It starts off with a quick pulse check. How am I finding you today? What's important about that is I might be sitting at a coffee shop waiting for my coachee, and they come in hot, and it's like, they sit down and they're like all stressed out, and it's like, whoa, okay, what's going on with you? It gives them a chance to let go of the day they've had, let go of what's on their mind, and focus on the space there. And it also helps you guide your energy as the coach. So, how am I finding you today? And what would be useful for us to talk about for you? And then every meeting, remember that bubble about the positive. Every meeting starts off with a good story. Give me a good story since the last time I saw you. Or if it's the first time you've met, I'd love to hear a good story from this year so far. Could be personal, could be professional, and they share their story. And you listen and reflect and help them unpack it. As you do so, they're connecting with their strengths. They're connecting with what's right about them and their environments. And it helps unlock that mental flexibility, creativity, and openness to new ideas. We use that to then jump into a positive psychology exercise that's linked with that meeting. And we have a whole curriculum, about 40 different exercises that we interchange. And I basically make up new ones each year because I get pretty bored if I have to do the same thing year after year. And we adjust it to what's going on in the world. So like right now, there's an exercise about values because that's really important in the world right now, in case you missed that. And then after you do the exercise, we shift to them as they're developing into a professional throughout the course of their training. So if this were a 10 out of 10 year and everything went great, what does that look like? Those are our big picture goals for the year. And then what do you want to accomplish between now and the next time I see you? So that they're moving towards those big picture goals by way of their short-term goals. And you continue to revise this, but also remind them of the goals that they've achieved as you move throughout the year so that they can build their confidence again and that self-efficacy. So there's a lot of information on this slide. This is just a way to sort of vomit all the data because we've published a bunch of studies about this. But the idea is as you meet with people, you assess their performance. They assess their performance. They focus on what's working. They think about their strengths. They set goals and an action plan. But also you have this positive psychology backbone. So as we've engaged in the thousands of meetings in the over a decade that we've been doing this, the studies have shown us that not only do people just start setting goals more often, but that we've seen decreased emotional exhaustion, improved reflection practices, and that those two are really linked. Because one might argue, well, what's the difference between this and just setting aside time for people to meet with a really nice person for coffee? It's that reflection piece that really ties into the reduced emotional exhaustion and improved well-being, as well as enhanced satisfaction with their training program. People are more likely to recommend their training program if they've had a good experience with coaching. And then what we have shown is that people who we're like, all right, so who is this for? A lot of times reviewers of papers will be like, who benefits the most from this? So we studied that. And it actually turns out that the greatest change in people comes with those who have really high burnout at baseline and very low goal setting tendencies, because this creates a structure for them to be able to do that. And that in particular, the ways that people are changing and how burnout and well-being might be changing for people seems to be really tied with this sense of enhanced resilience. Again, not making people more resilient, but helping people be connected with their resilience, as well as improving tolerance of uncertainty, is really tied with these factors. And like anything else you'd expect, the more you show up and the better it goes with your coach, the better your experience is. And we've seen changes in the coaches themselves, and we've seen changes in other variables like coping scores and different well-being scores. And what's really cool is we have a study that's coming out soon, which actually shows reduced self-reported medical errors and burnout in our coaching cohort. And what we really think we can tie that to is that reduced uncertainty. So I'm not worrying about and perseverating about whether or not I made a medical error. I had a chance to reflect on it and either own it or let it go. And that's so much of what coaching can help to do. Our first coaching RCT that we published, that was actually the first that of one-on-one coaching with residents that has been published, was through the Association of Women Surgeons. And we saw positive improvements in professional fulfillment and all the other variables that we looked at. And that we saw that, again, this sense of intolerance of uncertainty changing and improving over time, being really linked with our positive outcomes and changes in coping skills. And we were able to show in this study that the more you show up, not only the more you like it, but actually the more your experience will change. The better outcomes you will have, the more coaching you receive. We then replicated this study in a pediatric surgery association, and saw improvements in many of the areas we had already seen, but also saw we really geared the curriculum towards gratitude and positivity and well-being, and saw changes in that. So this helped us see that actually we can impact the outcomes of the coaching experience based on that curriculum that we developed, because otherwise all the other pieces of it were the same. So naturally, when you do really great things for learners, faculty are like, what about me? And so we were actually able to do a study where we were able to take a fund of money that was earmarked for physician well-being, and we were able to train a cohort of 20 faculty members, all physicians, although spoiler alert, hopefully this is actually going to be launched with APPs and nurses in the coming year. But we were able to train and certify coaches through Well Coaches, which is a national coaching education group. And we trained them up and got them going in coaching experience. And then we did a pilot a randomized control trial where we took 100 physicians and half of them got coached right away and half of them got coached three months later. And what we did throughout that is we measured them every 3 months. And what we found was not only was this very successful, but having an internal coaching program rather than paying external coaches, either whether they are or aren't physicians, was not only cheaper, but we still have them beyond the course of the program. And these coaches were able to do that cool thing where you can take what you're learning from a one-on-one conversation, combine themes together, and use that to advocate on behalf of these individuals, enhancing value, enhancing engagement, enhancing trust, and impact workplace culture. And so the coaches then share their themes and use that in leadership conversations. And we now have a regular approach that we use throughout our physicians organization where our coaches are the conduit for information that then gets fed up to leaders. What do we need to hear? What are people thinking about? And so we can use this in a lot of different ways, but now our coaches do retreats and they do one-on-one coaching and group coaching and leadership development for different groups. And we've been able to do different focus groups for people as well. And what we found in this randomized controlled trial, though, is not only was it cheaper and did we have this great resource and it was really achieving a lot of internal organizational metrics, we were able to show that there was a large decrease in burnout in the coach group compared to the control group, and that we were able to show several other positive impacts, such as professional fulfillment, engagement, and many of the other variables that we looked at. And so the way that this all then came together is we now have this overarching network of coaching that runs from novice coaching, meaning we have faculty who volunteer their time and they get those skills, and we pair them with trainees. We have listening sessions where these certified coaches facilitate discussions, and like I mentioned, they share that up with leaders. We do group coaching for community building within either affinity groups or role groups, or perhaps divisions or departments, and we use that to build community within them. And then we have one-on-one coaching for faculty, and our hope, as I mentioned, is that this will be expanded to APPs and nurses as well, using APP and nurse certified coaches that we will be investing in. So you might say, well, isn't that great for you at MGH? But that's not exactly what we have here. So what I want to share with you in our last few moments, and I'm going to give you a very quick overview of an exercise for each of those round circles that I showed you earlier. But what I will promise you is that I have this all in a PDF that I'm happy to share. And I'm happy to share the slides as well, so that you can reference back to these, because these are the kind of exercises that I would recommend you put in your back pocket, you keep there. And if you encounter a learner, or you encounter a colleague, or even you encounter a feeling like this in yourself, you can walk yourself through these questions, or you can pull it out and use this to have a different kind of conversation using those core coaching skills. So if we think about these different circles, we're going to walk through each one. So the positive thinking, the 3 good things exercise is not one that I've created. It's great data for it. It was built out of Duke originally and now has spread so far. And the idea about the 3 good things is that rather than ending your day thinking about all the things you didn't do, all the things that were hard that day, and all your frustrations, you end the day thinking, what felt good about today? What went right about today? What was right about me today? What did I do for people today that changed their day? Whatever your prompt question might be. And also considering, what are you grateful for today? And ending each day, not just thinking about this, but data actually shows that your outcomes are better if you write them down and really reflect on what made that happen for you that day. And in fact, it doesn't take a long time to do this, that doing this for just a couple of weeks has great impacts on your mental health and your efficiency and your creativity for months to come. So worth it to pull this out. Even as I share it now, I'm like, you know what? I probably could do this a little bit more often and encourage this. This is a great one around the dinner table too. And I love to do this in elevators. I encourage surgical teams to do this as they're scrubbing in. Just a way to connect and think differently. Now, getting at intrinsic motivation and purpose, really connecting with what about your work is truly meaningful to you. What about your work brings you joy? And what gets you out of bed in the morning? Think about that for yourself. Think about that with somebody else. And then consider to yourself, how connected am I with that? What's one small thing I could do to really feel and be connected to that intrinsic motivation and purpose on a given day? What's one small action I can bring to it? And even better, remember what I said, as part of coaching is getting our voice and thinking about how to use it. What's something that's getting in the way of you living your purpose and being connected with your intrinsic motivation? Who could you share that with? What's one person you could share that with that might help? And then confidence. What are the strengths that you can always rely on? What are the strengths that have gotten you where you are today? Who are you at your best? When are you at your best? And what really supports that? And how can you use that to approach challenges differently and help you achieve your goals? This one I find I lean on whenever I feel like my back is up against the wall, or I have to do something and I just don't know how to do it. This exercise really helps me focus on which Carrie needs to show up today. How do I connect with her? How do I channel my best version of me to get me through that? Now, I can't be that person all the time. That's exhausting. But when I need her, she is there. I just need to connect with that. And then considering social supports and resources. So who and what fills your tank? What drains your tank? This is one of my favorite exercises because almost every time you do this, you recognize, like, oh my gosh, I'm totally wasting energy on this thing and I need to just walk away, let it go. But the idea is naturally, it's like, oh, what's one thing you could do more to proactively fill your tank? That's like the first thing you might think of. But I'd push you guys to think about what's something you could stop doing or something you could change the way you do it that would drain you less? So, not taking more time, taking less time, which then naturally means you might have time for something that might proactively fill your tank. Another really important question to connect with is how can you tell when you're getting low? For me, if I start double reading emails I've already sent or apologizing for things that actually weren't my fault or beating myself up about something, I know my tank is getting low. Lack of self compassion is a red flag for me that I need to take a moment and fill my tank. Each of us has that tell that, and we're probably the first people to see it. So ask yourself, what is yours? And then thinking about what's most important and focusing on that. I'm going to give you an example from my own personal work experience about how I use this and how it has transformed my professional fulfillment. So for me, when I did this exercise and I thought through, if you look at each of these circles as a question, like what gives me positive emotions at work? What makes me feel good? For the engagement, what could I do where I could just completely lose track of time? For R, what are the relationships that am most connected to, that are most important to me? M is meaning. What really matters to me and what gives me meaning in my work? And then accomplishments. What are the accomplishments that I'm the most proud of? So when I did this, what I realized that the relationships that mattered most and the engagement and the positive emotions was that moment in the room with a patient where like I knew they were sharing something with me because it was me, because they trusted me, because they felt like I was their person to connect with and it changed the course of the visit or the course of their experience. Those are my favorite moments, and I realized as I was overloaded with in-basket and notes and emails that I wasn't doing that as much, and I felt behind, and I felt really frustrated, and I recognized when I was doing this that I had actually stopped prepping notes. I'd become so important and so busy that I wasn't prepping notes, I was sending emails, and I was making my in-basket smaller. And I thought to myself, what if we just went back to basics and prep just my annuals? I'll just prep my annuals so I get that like clicky taskmaster stuff done. And walk in the room and I already know what they're due for and I know everything. Basic stuff, right? We learned this stuff in med school, but I had stopped doing it. By recommitting to doing that, and not only that, but closing my email during clinic and turning my cell phone over so I'm not getting a million pop up text messages, what I found was I bought myself several minutes back in the room with the patient and my conversations changed. And not only was it good for the patients, I could feel the ways that it was great for me. And I love what I do. And I love it more than I did before I changed this. So that's one great example about how even taking a few moments to focus on what's most important to you and choosing one small thing that you can do that's actionable to change that is really empowering and helps improve your well-being. So, well-being is complicated, and it's about us and it's about who we work for. And those two variables interplay greatly. We don't have a ton of control over everything, but we have control over ourselves, we have control over what we bring to our well-being and how we choose to use our voice. And coaching is one way that can help us identify these factors and really consider how we want to use our voice. A great way to start coaching now is to really just focus on that listening to understand, that listening with a beginner's mind, reflecting back what you've heard, and trying those how and what questions. And these exercises can help you today to really think about for yourself and for others how to identify and advocate for a workplace environment that supports your well being. I'd love if people would fill the chat with ideas or commitments that they're willing to make today. I don't know if that's possible in the webinar, but I would love to hear ideas that people have after listening to this. And I welcome your questions and appreciate your time. Thank you.
Thank you, Dr. Palomar. That was wonderful. Thank you for sharing it with us your clearly years of experience in this important field. And just to add, yeah, please do. We have a few questions in the Q&A already. Feel free to put any comments in the chat as you requested, or put more questions in here and upvote them. I want to start with Dr. Artandi first. I'll cue you up first, and then again, I'll jump to some of the questions here as well. Thanks, Dr. Artandi.
What a fantastic talk. Thank you so much. My question is, there are different aspects of coaching and medical education that programs use, such as skill coaching or developmental coaching. How do you decide what to focus on?
So what I try to keep the lanes separate, although as an educator, like sometimes I'm on the wards and sometimes I'm specifically somebody's coach. Sometimes I'm mentoring. So what I try to do is if I am specifically someone's developmental coach, I do not involve the other types of coaching that people can use. I try to avoid the remediation coaching, the skills coaching, and other things, and help them identify who are the supports and resources that they can lean on for those. Now, when I'm just like an educator in the system, what I try to do is weave the skills of coaching into all the other relationships that I have. And so if I am doing skills coaching or if I am doing a remediation conversation, I try to do it with my best coaching approach, which what I find not only changes the conversation for them, but it really changes it for me. Like that dread that you have of like that difficult feedback conversation suddenly becomes this like super engaging conversation where you both are leaving feeling like something good just happened there. So I think it's important from a programmatic standpoint, if there's a typical particular type of coaching that's happening, you stay really true to that brand. But if you are an educator like in the system, trying to weave coaching skills into everything that you do can really just improve the experience for everybody.
Great, thank you.
Thank you. And we're going to go to the next question. I just want to give a quick shout out to Rebecca Merrill. I know she's listening right now. She's one of our physician coaches and help run a program. She implements a lot of the amazing strategies you mentioned today about strategies of how to focus on burnout and wellness and make your job really resilient. So thanks to her, and she's listening right now. So just want to give her a quick shout out. Many of our program members here, Dr. Dunn and Harmon and Dr. Artandi, have been through our program. I want to jump over to, you're welcome, Rebecca. A question here from it says, well, thank you for sharing your seminal work, Dr. Palomara. Are there any elements or referrals to cognitive behavioral therapy as applicable in the coaching process?
Yeah, so it's really important to recognize that line of coaching and therapy because you can get pretty close to that line, particularly when people are bringing like real life challenges or a behavioral health need to the conversation. So, very often a coach might say, I have some thoughts about, how we can talk about ways to support yourself and improve self-compassion or positive self-talk. But I'm also hearing that this might be something that would be useful for you to address in another relationship, like with a therapist. And then, is that something you've ever thought about before? And I'll find when I get like kind of nervous and I like say that they're like, oh yeah, I have a therapist. And so I'll often say, okay, so can you make sure you're talking to them about this? Because I'm hearing this really live in this conversation. But if they don't, what our program is set up to do is so we have 10 different fellowships and residency, or 10 different departments and their fellowship and residency programs within. So for each, we have like sort of a guide, like if this is a pediatric resident and you think they need therapy or support, here's who you call. If this is a this resident, here's who you call, so that people know how to help someone. Because what we try to do is actually empower the trainee to seek out the resources that they want for themselves, as opposed to the coach doing it for them. But they can share the resources to decrease the amount of work that would be for them.
Thank you. We have a few questions from Dr. Golden here. I'm going to combine a few. I see some themes in it, which are helpful, but he asks a few questions such as, do you see any specific problems with coaching, like the number of patients in clinic decreases burnout? He also has some questions about AI. I love AI, and we can ask that for any topic these days. Like, how will AI affect what you just talked about? But essentially, will it involve with burnout and how we coach people really as well? You can coach yourself on ChatGPT and other LLMs.
Yeah, so I mean, I think what's important about all of that is there were two parts I would like quickly looked at, and hopefully I represented this well in my answer. It's really important as an organization, and this is sort of separate, this is more like organizational well-being as apart from just coaching, to recognize that if we do things to make an already undoable job a little bit better, We should not replace that time and work with more patients. And I understand why organizations want to do that.
Mhm.
And I really push back against that because it's not making the job easy. It is making the job more doable. It's making a complicated job more manageable. And so these tools cost money, and organizations do need to figure out how to pay for these things. And I think there's a way to do that rather than to continue to task clinicians to do more and see more, just because the doing and the seeing has become a little bit less of an overwhelming lift. I do think that AI is a wonderful way to be able to improve what's happening in the room with patients because with that you can really connect with what your meaning and your purpose is without really worrying about the computer. Some people, Epic isn't a big deal to them and they don't feel that burden, but other people it is everything and they hate the typing and they hate the clicking. And if AI can change that and really enhance that patient clinician communication, then it is a wonderful tool. And I think like anything with AI, you use it right, it's awesome. And there will be some like, I think coaching is a great way to sort of strategize of like, how do I do this? Like I've never, like I think for a lot of people, they're like, oh, this makes me nervous or this feels uncomfortable. I think coaching is a great way to think about how to implement that.
Excellent. One question here, it's come up often in coaching. Has it come up often in coaching that the best way to support a person is actually getting them involved in therapy rather than just coaching alone? Sometimes, right, things come up that are underlying that need to be addressed. Is that a thing that we need to watch?
There's never one answer for everybody. Like some people do need therapy. Totally, right? Like you see the people in your office and you're like, "Wow, like I'm worried about you." And I hope you feel empowered to be able to connect with someone for a moment and say, "I care about you and I am worried about you." And I think that coaching can be helpful in those situations, but it should not be the only answer in those situations. But many people do not need therapy to solve their workplace challenges. And I think that coaching can be very helpful in helping people, again, find their voice, identify the drivers that are really frustrating them, and consider the efficiencies that they can be a part of, and think about how they can effectively use their voice in a way that doesn't frustrate them further, but really empowers them. And how another thing I think as clinicians, I do a lot of working with practices who are implementing standardization and change. We also do need to learn how to accept help and how to change the way we've always done things, which is hard because survival mechanisms as busy clinicians develop for a reason. And it's hard to let those go and recognize there may be other ways to do things in a new system. And I do think coaching can be really helpful for that.
Thank you, Dr. Harmon. Thanks for sharing the link. Dr. Harmon plays a big role in coaching development of our faculty here. Sent a link for people to reach out to. We can also include that in the follow-up. So in the recording of this, we'll send that link out. And also, Dr. Palmer, you mentioned some materials.
Mhm.
Include that as well if you'd like. And we just hit 9:02. Sorry for going over, but thank you for presenting with us online today. And thanks everybody for sticking with us.
Thank you for having me.
Have a great rest of the day, everybody. Thank
Bye,
you.
everyone.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.